Hi everyone, welcome to my new webinar. Today, our guest is Dr. Michael Mansour, who is a physician and scientist at Mass General Hospital. He specializes in infectious diseases, especially in immunocompromised patients. He also leads a research lab dedicated to understanding neutrophils, which are the immune system's first line of defense against fungi, and how these cells respond to certain species like Candida and Aspergillus. Thank you, Michael, for being part of this interview today. Your insights are very valuable to us.
Great. Thank you so much for having me. I'm very excited.
First, for people who might be new to this topic, what exactly is medical mycology and why is this an important field?
That's great. I think through people like you, Ida, we have an appreciation of mycology in the environment outside of infections of patients.
Mhm.
And then there's the other part to this, which is that there's, an interface, what we see outside, what we see on a hike or in our environment can also interact with us. So, medical mycology is a field of study that looks at all the diversity of fungi in the world and which of these can interface with us. And there's actually a very small percentage of everything that we know of all the diversity of species that can actually cross over and actually infect us. So medical mycology looks at this short list of fungal species that can infect us,
Mhm.
and begins to understand where it goes in the body.
Mhm.
Is it localized to one part of the body? Does it spread to other parts of the body? What parts of our immune system respond to it?
Mhm.
What medications can we use to control that infection? And so medical mycology it's very interesting, and it's all about how we interface with the fungal kingdom
Mhm.
and how it influences us and our health.
Mhm. Yeah, thank you for your explanation. Before asking more questions about the field itself, I'm also curious about your story. So, how did you first get interested in studying fungi and fungal infections?
Gosh, I can remember back to maybe college or as I was entering medical school. Uh, um, I went to medical school at Boston University School of Medicine,
Mhm.
and there I first really fell in love with immunology. I loved learning about the immune system, how we have these amazing cells that can recognize different pathogens trying to invade us, and how they work to clear those infections to keep us healthy. So I joined an immunology lab as part of my PhD. And that immunologist happened to also be an infectious disease physician.
Mhm.
Um, and his name is Stu Levitz, and I've been friends with Stu since that time. He now works at UMass Medical School. He's an amazing physician scientist and a
Mhm.
real role model for me.
Mhm.
Um, and his pathogen of choice was Cryptococcus, which is a fungus that grows really abundantly in bird poop, specifically pigeon poop.
Mhm.
And so you can find Cryptococcus in every major city in the world. It's found all over the world. And it can, when we get exposed to it, it invades the brain and it causes meningitis very commonly. And so he introduced me to Cryptococcus as a pathogen to study, um, when I was looking at immune responses.
Mhm.
And as I looked at Cryptococcus and really studied it, I thought it was just fascinating. I really thought it was beautiful. Like
Yeah.
it was a very pretty, beautiful sort of yeast to look at underneath the microscope. Um, and the more I just learned about Cryptococcus and then subsequently the fungal kingdom,
Mhm.
I just thought they were gorgeous pathogens, really beautiful, really pretty. They play such a critical role in our environment. Um, they've now been shown to be responsible potentially for the loss of dinosaurs. They've played a huge role in evolution, of even our species, and the world. Um, and that happened very quickly. back during my PhD years, and it's never left me since then. I've just really admired them. And now I'm a physician, as you mentioned,
Mhm.
taking care of patients who are at high risk for fungal infections. And so, till this day, I find the molds and the yeasts and the dimorphics just really amazing species to study.
Speaking of fungi themselves, again, like going back to the specifics of the field, how do fungi that can normally live harmlessly in our body or around us suddenly shift into causing disease? So I'm curious about what triggers that change.
That's a great question because we do have a normal flora. We have normal bacteria and fungi that live on our skin, in our mouth, in our GI tract, and they don't cause us disease. And I think that's and if you really think about that, it's like a checks and balances, situation where we have a healthy immune system. I have bacteria and fungi on my skin or in my mouth, and they know to stay in a safe place, and not invade into where they shouldn't be. And the way that's done is that we have barriers of protection, we have an immune system, um, and if we are healthy, you keep that very delicate balance where they stay in one place, they don't go where they shouldn't be. I think the problem is when you lose that barrier. So if you are on specific medications that disrupt the healthy lining of the mouth or the GI tract, or you need to have surgery, for example, and someone makes an incision through the skin and they disrupt the barrier. Um, or if you have a problem with your immune system, you're a person who has, unfortunately, cancer and you're receiving chemotherapy, many of the chemotherapy agents as a side effect can really dampen or destroy your immune system. So I think when you lose that balance, no barrier, loss of immunity, then there's a shift. And now these fungi see an opportunity to go where they shouldn't be. And you get invasion and you get infection. So that's the most common reason I encounter patients with fungal infections is there's been a disruption of healthy immunity, barriers, or even a disruption in the normal flora. So you lose a lot of bacteria from antibiotic use. Fungi will overgrow that scenario, and they have another opportunity to invade.
I see. And how do clinicians diagnose fungal infections?
Oh gosh, it's actually quite a challenge. As beautiful as they are, they're sometimes
Mhm.
hard to find. So what do we do? One, we can see rashes on the skin. Sometimes it's pretty obvious. So if someone has, for example, fungal nail infection, a
Mhm.
nail infection, or a superficial fungal infection of the skin, um, we can see those. There's like clear rashes that we can recognize. And then if you take a little scraping, so if you take a scalpel or a sterile instrument and you scrape the skin a little bit and then look under the microscope, you can see hyphae. You can see fungal elements in the skin. So that's easy. That's pretty straightforward. The problem comes when it's a deep infection. It's in the lungs, it's in the liver, it's in the brain. Um, those are harder to diagnose. Now you have to sort of reach in and try to collect a biopsy. And those are harder to diagnose. So I think in the field of diagnostics for fungal infections, I wish we had better tools. So nowadays, if I do a X-ray, a CAT scan, or an MRI, and I see lesions in an organ, I think, oh, this could be a fungus.
Mhm.
But the real way to make that diagnosis is we have to reach in and get a sample of it. And we do have instruments and tools and ways to do that safely.
Mhm.
Um, but it is an invasive process, and we have to now find a way to get in, collect some of what we see on the X-ray or the CAT scan, and grow it in the microbiology lab. And if it grows mold or yeast, then we know from that specimen, from that site, we really do have an invasive fungal infection. And sometimes we don't get to do that. You can imagine parts of the brain, it's hard to get into the right area to get a biopsy. Sometimes it's not safe,
Mhm.
in which case we just have to guess. And we say, it looks like a fungal infection. I think we're just going to move forward and treat without knowing definitively. So those are, it's a difficult area. And I do wish we had better tools to make that diagnosis.
Mhm. Would you say that it's harder to catch or contract fungal infections than bacterial or viral infections?
Yeah, that's, if you weigh out all the different pathogens in the world, I'd say, you know, we can have a normal immune system and we can all catch a cold.
Mhm.
We can all catch the flu.
Yeah.
Um, we can also have strep throat, or a bacterial infection. So those are easier. Those are more infectious. Sometimes they can look for really small opportunities and really invade. Fungi, I would say, they're difficult to really experience a true infection with a fungal pathogen. If you have a healthy immune system, I'd say it's incredibly difficult to
Mhm.
really get a fungal infection. You really need to have some major defect in your immune system or a barrier, but you need something a little bit more compromising, something that really changes your overall health to get that infection with a fungal pathogen.
I see.
Bacteria and viruses really do seem easier to catch.
I also learned that many medically important fungi also exist in our environment. So, how would you say ecological research can help us better understand why certain fungi become pathogenic? Or, like, in other words, how can ecological research inform medical mycology and the process of designing better treatments?
That is a really critical question. And it's really appropriate and well timed now.
Yeah.
Let I'll paint a picture of current theory. Okay. This is what we know.
Mhm.
We know nowadays the rates of fungal infections seem to be going up.
Yes.
And we know that the number of species, you know, um, were quite restricted. Those that can infect us, they were quite restricted as a smaller number of fungal species.
Mhm.
But nowadays, it's becoming more diverse and different types of fungi that many years ago we would never see in a patient now appear to have made some sort of transformation and now they can invade human beings. So many people have wondered why that is. And when you do ecological research, looking at environmental fungal species, what that type of research is beginning to show us is that as we undergo global warming, areas of the world that were quite cool or cold um, didn't allow for a large number of environmental fungi to grow.
Mhm.
But as global warming is setting in and those warm zones are expanding into the north and southern hemisphere of the world, we're seeing in soil that usually had a cold cycle. So it really dampened the amount of biodiversity of fungal pathogens now has higher amounts of diversity because it doesn't get as cold as it used to before. So one theory is with global warming, our ecological mycology colleagues are now seeing there's more and more diversity of fungi spreading through the world because temperatures are changing. And now that means people living in those areas that would have never been exposed to those types of fungal species now are exposed. And we're beginning to see that in certain medical centers, like up here in Boston, we didn't really get a lot of aspergillus or other mold infections like rhizopus or other types of mold species. Nowadays, we are beginning to see an uptrend in those infections, and we really do think it's because of environmental changes related to global warming. That's one theory. I think without ecological research, we wouldn't know that's happening. So there's a clear dependence and critical nature of that type of research. I need to know what's in the soil here in New England. I must know because as patients come to me for care, it really matters where they are, and it matters what's in the environment right now because that certainly could have been the cause of their infection. So without doing that research, as a medical mycologist, as someone who's treating patients who come in with infections, I really, I'd be flying blind. I wouldn't know exactly what their exposure, risk would be without that kind of research. So I find it critical and very important that it's performed.
Looking ahead, what changes or breakthroughs do you expect in the field of medical mycology, like in the next 5 or 10 years?
Great question. I think in the next time period of our lives, I would say in the world of fungal infections, I expect a couple things to happen.
Mhm.
One thing that's happening now is we're understanding more about the metabolic biology of fungi. And that has led us to develop some really improved medications and therapies. That's really exciting. We had very few drugs before, and I'm very pleased to report that in 2025, and as we move into next year, there are new drugs available. So we have more tools to really help treat patients. These fungal infections are very devastating. And so without having enough therapies to really address them, we've seen some, really incredible, devastating, losses of life and quality of life of patients who have these infections. So I'm excited that there's new therapies
Mhm.
that are coming up. The other big areas that are exciting is that we're understanding more about the immune response to these fungi. You mentioned neutrophils, so we're learning more about innate immune responses and how our immune system recognizes these fungi. And there's now new therapies to really enhance that immune response to help clear those infections. So, like a immune booster therapeutic sort of approach, and that's new. We've never really been able to do that very well in the past, and I think we have new tools on that front as well to boost immune responses to fungal infections. So drugs to treat them directly, but also drugs and therapies to boost that immune response to them. And that's exciting. And then I think other things that may take a little bit more time are those diagnostic tools to make the diagnosis directly. There's some new theories and approaches to how to develop those diagnostics. And I think in the next 5 to 10 years, we'll see a really nice array of tools that we can use to definitively make the diagnosis. And that helps us get to the treatment faster.
Mhm.
And the faster we get to the treatment, the better someone's outcome is. So I think in the next 5 to 10 years, diagnostics and really novel therapies are two really exciting areas in the field of medical mycology, and I'm looking forward to those to help our patients out.
Yeah, that's definitely really exciting.
It is.
My last question is specifically for my audience. So
Yeah.
many of my readers are enthusiasts or early learners, but not like professional scientists. So what advice would you give to, these people who want to learn more about medical mycology or even do research one day?
We need more people like that. You've spearheaded this area. You've taken your amazing interest from the environment and you've brought it right here to the lab. And I think, there's a spectrum of how much you can engage. I think for those who just want to learn a little bit about medical mycology and how we manage fungal infections in the hospital, there's some really nice um, webinars and online, instruments that can really teach you a little bit about that. And I'm happy to share some of those links so you can share that with your
Oh, that would be
readers.
awesome.
Yeah, so there really is some really nice there's some good books that have been written by medical mycologists that can really explain to the non-scientist, non-physician um, what the challenges are with fungal infections. So there's some really exciting new literature and links that can be used. I think if you want to go more intense and
Mhm.
really learn about medicine and research, um, I think platforms like yours
Mhm.
are fantastic. Listening to interviews, listening to scientists speak about that are really exciting. Come in and visit us. I think you'll find most scientists and physicians who work on fungal infections would love to interface and talk to people about what their research means, about what the challenges are, what the upcoming breakthroughs are. We would love to do that. So I think if there's a ability to reach out to someone, I think you'll find that you would be welcomed to come and visit the lab, or have that person come and visit your community, whether it's high school, college, your workplace, and really come and give a talk. So we do that quite a bit, and we would really love to do that.
Yeah.
So reach out. We are here to help patients, but as part of doing that, we all need to appreciate what the impact of this research is, and our, part of our mission is education. And so we really take that very seriously. If we can't explain to everybody how important this work is, then that's a loss on our part, that we're not really demonstrating how well and how important this work is to keep everyone healthy. Um, so use those links, read those books, reach out to us, have a conversation. Um, I I would love that, and I'm sure many of my colleagues would also, welcome anybody with open arms.
Mhm. Thank you very much again for taking the time to speak with me. I really enjoyed learning about your experiences and your insights, and I'm sure that this information will also be very valuable for my audience.
Thank you so much for having me on. I really appreciate it. I hope we have more of these
Mhm.
conversations. And if people have questions, um, let's talk again, and we can
Okay.
even answer some of these questions, so we
Yeah,
can really bring this interest and these important areas to everyone's attention, if that's what they would like to learn about.
that would be awesome. Thank you so much.
You're very, very welcome. My pleasure.